But we are continuing to keep you updated with the very latest information when it comes to the coronavirus, COVID-19. Just before we joined by our guest here, we want to give you a couple of updates. We just heard recently that Buku Festival has been postponed to Labor Day weekend. That is the latest when it comes to festivals and large gatherings that are in the city of New Orleans that are being postponed. So Buku Festival just announced that they are being postponed. And we're also learning Suno, they're adding on to that list of the number of classes that will be held online. They will start holding classes online on March 23rd. That's when that begins. But today they ended classes at noon. Tomorrow they will also end classes at noon, obviously giving themselves an opportunity to gather up themselves so they can figure out what their plan is moving forward. But again, the Buku Festival, that has been postponed, and Suno will hold online classes that'll start on March 23rd. And I want to just introduce our guest that we have here, because we have so many questions that you all have been sending to us, and you can continue to send us your questions. 504-529-4444. Text the word virus. You'll get the latest updates. And also, if you have questions that you want us to answer, text them to us. I have my computer right here. We'll make sure that we get them to our guest. And our guest right here, we have Dr. Maureen Lichtfeld. She's with Freeport McMoran Chair of Environmental Policy. And she has also spent several years, 18 years if I'm not mistaken, correct, with the CDC as well. And Dr. Ronald Blanton joining us again, the Chair of Tropical Medicine at Tulane of COVID-19 Response Monitoring Task Force. Thank you both for joining us.
Thank you for being
here. So obviously, one of the reasons that we're here to dispel some rumor, of course, to answer a lot of questions. There are a lot of concerns, and there are also a lot of facts that are being thrown around that have some people sort of in a tailspin here. They're all over the place with what to believe and what to expect from this virus. So can you just go ahead? I know that you guys are probably hearing a lot of rumors. Is there anything that you're hearing that is kind of one of the most ridiculous things that are out there right now that you would like to dispel?
To panic is a ridiculous thing. To say that you only have to sit at home and don't go anywhere, that's pretty ridiculous. I think we need to be sensible. If you are sick, if you are coughing, do not go to your primary care doctor. Call first. Do not go to the emergency room. Call first, because then we're helping to limit the spread of the disease. If you're home with someone who has a compromised immune system, meaning someone with diabetes or someone with lung disease, make sure you distance yourself. Make sure that that person doesn't go into crowded situations. So there are a lot of things that we can do that make a lot of sense.
Yes, obviously, very sensible things here. One question that we do have here, a big question all of us have: how long does this virus actually stay in your system? I know that we talk about people self-quarantining and it's staying in your system for about 14 days or staying away from people 14 days, but does this mean after those 14 days this virus is gone, it's out? How long is it actually in your system?
It is actually in the system, in blood. It can be recovered after a fairly long time. That people who have recovered after 14 days still continue to have virus in their blood, although they appear not to be infectious. But it seems that several weeks is the time period in which you can have this. The 14 days is really looking at a range of the incubation period, the period from which you come in contact with the virus to the point at which you are then sick. That can be anywhere from 2 to 14 days, sometimes even longer, but in general it's within that range. But the virus itself can stay around longer. So
it's the 14 days is not necessarily about getting the virus out, it's to stop you from being infectious.
To find out the period in which you might be infectious for somebody else, correct?
Okay. Because during those 14 days, you might be spreading the virus, but you yourself don't have symptoms, and that's important. So we take those 5 to 14 days really as a serious period where you can spread the virus.
All right, speaking of that, we have a quick update that you guys have for you right now. Just getting learning that LSU plans to move to online classes. This will start on March 30th. So no classes from March 16th until March 30th, and starting March 30th, LSU will move to online classes. So that is the very latest that we're getting from LSU, of course, adding to the number of universities who have switched to online classes to limit that communication that you have with people, or that close in-person communication. A question for people with autoimmune disorders and with asthma, are they at risk?
Yes, that among other chronic diseases, those certainly rank up there. People with autoimmune diseases have a compromised immune system, as well as the other conditions are like people that have lung conditions, people that have heart conditions, people with diabetes, and just age in general gives an increased risk. But these conditions, even at a younger age, lead to an increased risk of serious disease with the infection.
I know that none of your viewers probably smoke, but if they know someone who smokes, a friend, a family member, this is the perfect time to quit smoking.
Okay.
Because we want to keep our lungs healthy.
Okay. So how does that worsen it?
Because if smoking affects your lung and how your lung functions. Smoking often is connected to bronchitis and to other what we call respiratory diseases. This is a virus that attacks that very system, that lung system. So we want to make sure our lungs are as healthy as possible.
Well, I have another question here from a viewer. What kind of precautions should we take when heading to the doctor's office for our regularly scheduled appointments? Usually there's sometimes a crowd in the waiting room. Should we be concerned?
If you are not sick, if you just have a regular checkup, call first, and actually a lot of doctors' offices say don't come now. If you are sick, call first and then take the advice of the doctor whether you should visit and where you should visit. But if it's just your regular annual checkup, call the doctor and postpone it.
And so call and postpone it.
Correct.
You believe?
Yes.
Okay. If you didn't get a flu shot, I know that a lot of people they've gotten flu shots. How important is it to get one now in relations to the coronavirus? Does that help? That's one of our viewer questions that we just got in.
We still are in flu season, and getting a flu shot now is still important. It will help, at least in terms of reducing your chance of being hospitalized. It is certainly possible with a flu shot to still get the flu, but a condition that's not as bad, as well as people can have both infections.
So people so you can have the flu and coronavirus.
Correct.
Does that make this worse?
Makes it worse because it's that same system, that lung system that's attacked. So now you have two viruses.
Wow.
So we want to make sure we do everything, the things we do to protect. Hand washing, sing happy birthday a nice, very long time.
Yeah, I actually played a lot of songs last night while I was washing my hands.
And often, the things that we touch often, doorknobs, surfaces, the refrigerator handle, make sure we sanitize those as often as possible. But hand washing is the best protection.
We talk about being sensible when we are going about our day-to-day activities. There are some people who believe that they need to stay inside, stay away from everyone, stock up on everything they can so that they can, until this passes over. But you say that you can still go about your day-to-day lives. You can go out to eat. You can go out to bars and restaurants. A lot of what we have here in the city of New Orleans. So some people are finding it more fearful to go out to eat. But what is it that you can do to kind of calm those worries when you go to a restaurant and you're sitting at a table?
I think what Dr. Lickspiel said about being sensible, when you go out, you are at risk when you come in contact with surfaces that many other people come in contact with. And the role of hand sanitizer would be at a place where you have no access to soap and water, that touching doorknobs in an outside place. You might have an opportunity to use at an extra time in places where you're going to have contact with common surfaces. But for the most part, and especially if you are someone, say, less than 50 without chronic disease, your risk is reasonably small for ending up in the hospital with serious disease. So I think you can still take reasonable precautions. Separate yourself from large gatherings, but small gatherings should still be possible.
Yeah, so and you brought something up about hand sanitizer. Dr. Lickfield, do you have sort of a problem with that?
Well, if hand sanitizers can be used when you can't wash your hands. So
Yes.
it's really important not to replace good, solid, and frequent hand washing with hand sanitizer. And also, both hand sanitizers and those sani wipes are effective if they have an alcohol level of 60 to 70%.
And I think people have been panicked about the run on sanitizer, et cetera. I haven't seen a run on soap. And soap is cheap. It's in your household. It's the thing that you should be using. But any of these measures have to be used correctly. You have to use enough sanitizer to moisten all of your surfaces of your hands. Remember your wrists. Remember between the fingers. And the same with soap. And the most important part of soap is that it carries bacteria away from your hands. So the soaping part is important, but also important is the rinsing part, that you have to have it underwater for the twice happy birthday.
Twice happy birthday. Yeah. That's something that they told me when I was a little girl, and it still stands today. A viewer question here, who has someone who has parents over at the Lambeth House. The administration not informing them of who has been diagnosed and hiding behind HIPAA. Does HIPAA prevent tracing contacts in a crisis such as this?
That's a difficult question. We have to follow the rules that HIPAA is, and I'm sure that if that person's family member is affected, that person's family member will be informed. But I don't think that a person who just calling and say, well, tell me who else is infected or tested positive, that's information that you give away, because that's confidentiality that the Lambeth House and all other institutions sign off on.
Okay.
And contact tracing is a function of the Department of Health.
Correct.
And that's the information that they use. It's not actually for, it doesn't help us to distribute that to the public.
Yes, no, not at all. Tell us this, I know that there's a lot of exchange of currency, the things that we touch, the money that we touch, are they affected? Can this live on money?
The virus can live on surfaces, and it depends on how porous the surface is, how long it will live on a surface. A cardboard, the length of the life on cardboard is very different than the length of the life on this desk. And so, again, hand washing is really, really, really important.
Well, a question.
And it's amazing, actually, how much we can do with our elbows. We can say hi, we can open doors. So use our elbows, use our feet, and we could say hi with our feet, and so.
You know, I've seen some pretty interesting ways to say hi to people in the last couple of weeks. Tell me this. We talk about when a person catches coronavirus, you know, the latest, I would say the bigger names that we have saw, Tom Hanks and his wife, both infected with coronavirus. When a person is infected with coronavirus, what is happening to the body? Or necessarily what that infection means?
I mean, it's a long, winding pathway through the immune system, but usually these viruses end up in the lungs themselves, infecting lung cells. And I don't know about this virus. I know that it is what they call cytopathic, meaning that it'll destroy some cells a little bit, but it doesn't seem strongly cytopathic, like it's really ravaging through lungs and eating them up. And there may be a large component of our response to the virus. Once the body sees a cell that's infected, it wants to kill that cell because there's no other way to get rid of virus. And that can lead to a lot of other damage to cells, perhaps, that are not infected. I don't know that that's the pathway for this disease, but that's the way some diseases cause a great deal of damage in the lung, is by our own immune response to the virus.
And this is why we really emphasize that people who have who are immunocompromised, who have a decreased immune system, because our immune system is pretty phenomenal. It has cells that will attack bacteria and viruses, just as this coronavirus. So if you have fewer cells to do that attacking, we are more at risk for the effects of infection by that virus.
You know, Dr. Lichtenfeld, you've spent 18 years with the CDC, and you have also had your experience with experiencing global pandemics.
Correct.
Have we seen something spread this rapidly across the world, really?
We have seen an H1N1 virus, we have seen H5N1. What's different about this version, this strain of the coronavirus is that it spread so quickly, and it really ballooned in China, and the uncertainty around it. I think what's really important for us is to have consistent messaging, is to have trusted messengers, and that the facts, just like you're doing this afternoon with us, that the facts are clear.
Yeah.
I think once you have that, people are very sensible. Each one of us can help stop the transmission, and we should do this together. And so it's not either one of us work. It's something that we do together as a family, whether we're here in our own home, in the city, in the state, in our country, in the world.
Well, it's something right now that we have seen happening, not just here in the city of New Orleans, but in major cities, smaller cities as well. The canceling of mass gatherings, of concerts, of people being in closed classroom doors, of any public event. They are either postponing, canceling, or saying that if it's over 50 people, we should do it. Is that the right move?
It's a hard call for any individual institution. A factory that is producing face masks with an open factory floor may have a different set of concerns from a school that has kindergartners and nursery school kids that are coming to school, as well as their staff is perhaps elderly and has comorbid diseases. So in each case, you have to decide exactly what the best approach is. You can go too far and you can go too little. I think we tend to side on the side of safety because we'd all feel really bad if we'd done less than we really needed to do. So I can't say, I think people are making decisions based on what they see on the ground, and they're probably making the right decisions.
Well, you know, this is a question that, you know, and we talked about this a little bit earlier, but we talk about animal transmission, but we have a viewer that asks, can the virus be spread through mosquitoes if they bite an infected person?
This is not really a vector-borne disease.
Right.
It's
Gotcha.
not transmitted by mosquitoes or other insects, ticks, fleas. So that, no, we don't expect that this will be transmitted by any insects.
But this is an opportunity to remind everyone, if you're coughing, cough in your sleeves.
Okay.
If you're sneezing, sneeze in your sleeves. Because in fact, a lot of people don't know that a sneeze goes much further than a cough. And so those are the important things for us to remember to do.
In addition, part of the reason for separating people a bit, what we were calling social distancing, is that even in casual conversation, whether you know it or not, you have sprays that can reach other people so that you can infect people even if you aren't entirely sick. Much less than somebody who's coughing, but that's one of the reasons that we try to keep some distance between people.
If you notice here on the set, we have quite a bit of distance between all of us.
Yeah, this is about the right size. This is about right.
So this is about as far as you want to be right here when you're having a conversation. You just have to yell it over the crowd. I want to go ahead and go to another viewer question. This one is a question that I had. You know, can we do anything to boost our immune systems to decrease chances of getting the virus? I know that you said that right now is a good time to stop smoking. But can we do anything to stop this from really hitting us harder than it does other people?
Eat healthy.
Okay.
Hydrate. And water, not alcohol.
Okay.
Make sure you take care of yourself. Just make eating healthy, drinking enough water, staying away from places where people are ill, staying away from large crowds, doing those things. There's a debate about should you take vitamins or not. I take a vitamin C every day.
Yeah.
So, but that's, again, those are individual decisions. If you have a healthy diet that provides you enough vitamins, then that's what you do.
Okay.
And get some sleep.
Get some sleep. You know, this is something we should be doing before this all happened, by the way. Hydrate, sleep, eat healthy.
And
correct.
I think what Dr. Lixby said about smoking, I was just thinking that this is a good time to stop, but that is for your entire life. The best thing you can do for your health is to stop smoking.
Yes.
Yeah.
Okay, well, this is another question that we have for someone, and we've talked about this before. We've talked about the flu, and people were concerned that, we've had so many people that have died from the flu, but what makes this virus so different? And they say, why is there such a panic when the flu affects the same people and kills more people every year?
This virus is different because we have not seen this particular strain before. So there is not enough what we call herd immunity among us. Whereas the flu, yes, the strains can differ a bit, but we've seen the flu and we see the flu every year. Now, if this same virus happens again, circulates again, then perhaps there will have more people with who are immune to it and help. The problem with viruses is that they change. They're smart.
Yeah.
And so they change their makeup a bit so that they become somewhat slightly another new virus. And then our body hasn't seen it before. So that's what makes it different. It's a new virus that hasn't circulated among us before.
In addition, I think I've heard other people comment that they are sick and tired of people comparing this to the flu, because it's not the flu, not in the way it's transmitted, not in the way that we are going to react to it. That the flu causes about 1% mortality, 0.1% mortality, and this virus, the best estimates now are maybe 1%. Which is 10 times more than the flu. In addition, when we talk about the flu, we don't think about 60 or 70 or 80% of the population ultimately catching the disease. In Germany and even here, some people have estimated that many people will be exposed to this virus. Most of them will be fine, but that's a huge number, a greater number of people, and a greater number of people who will have severe disease from this. This is no joke. This is a serious problem.
Yeah.
Well, this leads into my next question. If a person exhibits symptoms, but they aren't necessarily developing a serious issue, do you go get tested, or do you bother going to the hospital just for the purpose of being confirmed?
You stay home.
Just stay home.
You stay home and call your doctor. That's what you do. Hydrate, sleep, eat healthy, stay home.
Oh, and Dr. Lickfeld, I wanted to just ask you, there was a big question about testing. With the CDC sending out these tests. I mean, are we waiting for these kits for everyone to figure out? Are there enough kits for everyone who would like to get tested, or should we be saving these for people who actually show symptoms?
In the beginning, there were some issues, problems with the test, the type of test, and the accuracy of the test. There are many more factories and manufacturers working with CDC, developing more tests, and test kits become available, and each state is getting more and more test kits, and so the testing becomes more available.
Okay.
At the same time, I think depending on how, as Dr. Blanton indicated, depending on how many people already have it, you may not need to test everyone. What is important is to test people who are in that high-risk group. Remember the group that we talked about, older and with immune compromised system, to test them, people who are already symptomatic. So it's really important to make sure that we use testing for those that are most vulnerable.
Okay, so most vulnerable. And so once we get those tests, will we see those particular tests making their way to Louisiana and to every state that's affected, or will we rely on testing at places like LabCorp and Quest Diagnostics?
No, testing is already happening to the state health department, and confirmatory testing is happening at CDC.
Okay, so just to be clear of that, confirmatory testing, so these presumptive positives that we're having, we have the State Department doing that, CDC confirms it.
Correct.
And that's when we move forward.
Correct.
Okay, gotcha, I understand that. Does heat kill this disease? It doesn't matter what temperature, can it survive all temperatures?
I'm not exactly sure at which temperature, but I'm sure it can be inactivated by heat at a high temperature, but I don't know what the cutoffs are for the temperature.
And that's, I think we're learning a lot about the virus. We don't know exactly how this virus behaves and what kills it. So one more thing about hand washing. I know your viewers might get sick and tired of us talking about hand washing. Wash with water as warm as you can tolerate it.
Okay.
Because that helps.
The other thing that is important as well, although I don't know that you can actually do a lot about this, but it may give you more confidence, is that most viruses are pretty well inactivated by sunlight. Today'd be a nice day to to go out and inactivate some virus when there's sunshine.
Enjoy the sun.
Yes, enjoy the sun. UV light does a good job on inactivating viruses.
So if you'd like to just go ahead and lay out, this would be a good day to do it.
But use sunscreen.
But yeah, that's an entirely different problem.
Don't smoke and wash your hands.
Don't, so far that we've gathered from this, don't smoke, wash your hands, use sunscreen, eat healthy, go to sleep.
Correct.
And wash your hands even more. And if you can't get to your hand wash, make sure you use sanitizer.
Simple messages.
Very, very simple messages. We just have another viewer question. When cleaning, should you use disposable things like paper towels, or can you use the same rag? Does that spread it throughout? So we've seen, I don't know if you guys have been to the store lately, people have taken up all types of cans of Lysol, Clorox spray, and whatnot. I mean, what products are you using? Is this helping the situation?
It doesn't matter what product it is. It does matter the percent of alcohol that is in that product.
Gotcha.
So with one product is not better than the other product, how much alcohol is in it. And I would use disposable at this point.
Disposable?
Yeah, just use it and throw it away.
Okay.
A key element to that, again, it's washing a surface is like washing your hands.
Yeah.
If you're using alcohol, you want to use a high percentage.
Yes.
If you're using a detergent, you want to make sure you rinse well.
Yeah.
And the part about disposable means what you're doing is removing the virus and putting it somewhere else. So disposables are probably preferable to using the same instrument over and over again.
I know that we say that elderly people are mostly affected and people who have compromised immune systems, but one of the problems or worries that even I had a concern about, I just visited my 1-month-old nephew. So this was prior to the spread of the virus in Louisiana. Well, at least us knowing about the virus spreading in Louisiana, though it may have already been here. Are immune systems of infants, can they be compromised? Is there a way that this virus can affect them more than it could anyone else, a healthy adult?
If you think about the flu in fact affects the two extremes of our age system, the very young, so the infants and young children, and the older population. Now this virus seems to be more prevalent and affects more the older population. What we wouldn't want to happen is, let's say you've been infected, if I've been infected and I walk around with it, I don't have any symptoms, but I'm going to visit somebody else who might be in that at-risk category. So we want to make sure, whether it's a flu or the coronavirus, want to make sure we don't infect others. We take the precautions to make sure we don't infect others. Because yes, young children, their immune system is still building up, and that's why I'm giving you a lot of good messages here. Breastfeeding is enormously good to build up the young infant's immune system. And so you want to make sure that you, whether there's coronavirus or not, protect that young person.
Oh, you know, a lot of people, just speaking on children, you know, the biggest concern that everyone has right now, we're seeing universities going to online-only classes. You're seeing a lot of office buildings and people start to work from home. I think Twitter is doing a mandatory push for their employees to work from home. But so many people say, well, what about the schools? Are we not talking about our children? We know that children are not the highest at risk, but should we be concerned? Because if you've had small children, you know that they aren't necessarily washing their hands the way that they should.
Again, it's hard to say in any one instance what individuals should do. Different states have done different things under different scenario, and the same scenario has occasioned different responses. Looking at the state that I had worked in for 30 years, Ohio, the governor has said that he's closed all schools, and they don't have a situation like California or like Washington State. In fact, I think they have fewer cases than we have here. But that was a decision based on where they are at and what they think their school system is able to do. Everyone is worried when you do that is that you've changed all of society. What do all of those parents do when their children are at home? Can they be at home? Many people, and at least where I was at, and I believe in Louisiana as well, they depend on the school actually for food, both for lunch and for breakfast.
Entirely
and on the
different
weekends.
problem.
Right.
Yeah, that you're going into.
In school, if you do that, you have really changed the whole structure of society. So you have to think carefully about that and what are the risks of doing that.
Yeah, I was just talking with someone, with another reporter actually who's with CBS News, and the big conversation was, I know that we talk about shutting down schools, but what about the kids who depend on that school meal or for breakfast and for lunch? You know, that's the only meals that they're going to get throughout the day.
And they actually get a whole lot of other stuff from school, believe it or not, as well.
All right, sorry, go ahead.
So the social consequences of isolation and social distancing are an important aspect to consider as well.
So President Trump recently talked about suspending travel between the United States and Europe for the next 30 days. Will that make much of a difference?
At this point, it is difficult to, well, what we can say is that no longer is travel the sole and the more dominant way that transmission is happening. We now are in a situation where there's community transmission. And so travel plays a lower role in the transmission cycle currently.
I think the rationale is that travel has created nuclei in the United States who would not otherwise exist. And I'm not sure that the data are there. I can't say, I'm not saying that they are not there, but I'm not sure that I've seen data that shows that those nuclei from Europe have been the cause of outbreaks here, but I'm not certain.
Well, you know, speaking of that, the CDC obviously really taking a big role in this. What's happening right now in your experience, when you've experienced a global pandemic? What's the steps that are being rolled out so that they can take care of this problem, learn more about this? Because as this goes forward, you all mentioned that you're still learning about coronavirus. So this is essentially new to all of us. What is the CDC doing right now so that we can kind of condense this down to a season? Or do we expect this to last for months and months to come?
Currently, I imagine that at headquarters at CDC in Atlanta, this is being treated just like we have another disaster. So in a way, a pandemic is a disaster. And so there is an incident command system, and there are many, many staff who are with expertise, like the two of us, that are managing and answering questions. But there are also many CDC staff in the field, in the states and globally, to directly assist on the front line and working with state and local health department to address cases, to deal with transmission, to help with prevention and control. So they're really spread all over the world and within our states and in Atlanta. And so I'm quite proud of what's happening in public health practice. This is public health practice in action. And often when you say, well, you're a public health professional, as the two of us are, people might say, well, what is it that we're doing? This is it, what we're doing.
Yes.
I think that the WHO has also taken, at least their perspective on this has always been appropriate. They have been reluctant to call it a pandemic, mainly because it was a problem, and a worldwide problem, when it was just in Wuhan, China.
Yes.
They recognized that the whole world should be involved in that at that point. And the point that it's now declared a pandemic, really nothing has changed in terms of what we need to do. We need to do all of this stuff while this was, or at least plan for all of this stuff while it was occurring. So I think the designation of pandemic is only a recognition of what everybody else was seeing. But it was a problem before then for the entire world to cooperate on.
So, I mean, you know, oh, wait, excuse me, we have another viewer question coming in. What's the difference between the tests that the state has done, and I think we touched a little bit on this, but we can ask certainly again, the difference between the tests that the state has done for presumptive positive and what the CDC finds? So we talked about a little bit about this. Of course, the State Department does the presumptive positive. The CDC basically confirms. Is that correct?
That's correct. There are two different. Maybe you want to talk about the lab component of it.
They're more difficult. I think they're all what are called PCR, that is to amplify the RNA from the virus and be able to see enough of it either in a machine or on a gel that they can say that this particular virus exists there. What I don't know is which they're using different elements, different primers in order to amplify that, and that may be what the difference is with the CDC, or whether their protocols, at least for the amplification, this whole process, is different between the state lab and the CDC. The CDC has now approved sort of what we call ad hoc tests. That is, tests developed in hospitals, tests developed in businesses commercially, and tests developed at the state health departments. And so those are tests that they developed that will then be verified by the test of a similar nature, really, that the CDC has developed. And at least as of yesterday, all of the ones that were positive in Louisiana by the state test were positive at the CDC as well.
Well, I mean, another question that we're getting here, pregnant women. A woman just sent us a message. She's currently 30 weeks pregnant. Should I be worried about catching the coronavirus, and what happens to my baby if I do contract it?
So this is, although you wouldn't say that a pregnancy is very healthy,
yes,
and so it's not a disease, and so it's not in a vulnerable population. I have a daughter who's pregnant currently, but you want to make sure that particularly this woman doesn't get exposed, and so gatherings, large gatherings, so those are the things that I would avoid. Talk with your your doctor, should you come in for that regular visit? Is it another way we can do that? And so to make sure that we keep the mom and the baby as healthy as possible.
I think that's the key. We don't know that there is any direct effect of the virus on the baby, but everything that affects the mom affects the baby, and an unhealthy mother may lead to an unhealthy baby. And that's the reason to at all costs try to avoid this. But it doesn't mean that you'll necessarily have problems if you do contract the coronavirus. It's not like some other viruses that we know directly affect children, infants.
Okay, well, right now, if you're just joining us online, we are giving you the very latest in our coronavirus coverage. Obviously, there are so many things, so many questions that a lot of you have. We see those questions that are right here in front of me. You can continue to send them in to us, 504-529-4444. I'm just giving you some of the latest headlines. We do know that right now, Suno has decided to go online starting March 23rd. We do know that classes were canceled until noon today. Classes will go on at noon tomorrow. We also know about LSU. We are just learning that LSU is also setting their classes to go online as well. So those classes, I believe, are starting for the rest of the spring semester, which, unfortunately affects a lot of students who are in their senior year. We also have learned that the 2020 Buku Festival, that has been postponed till Labor Day weekend. So that's adding on to the number of festivals that are happening in our area that have either been canceled or postponed. Of course, this weekend we have the St. Patrick's Day celebration, Super Sunday. All of those events have been canceled. Any event that is a gathering of more than 50 or so people. So that's the information that we're getting right now regarding any updates that we have. We're even learning about Disneyland. They've closed their doors. NCAA has canceled March Madness. We know about the NBA suspending their season along with the MLB. NHL. Just saying all of this makes me think, so man, what about our sports department? But I mean, all of this, of course, out of an abundance of precaution, just so that, and it's not a fear tactic that they're using here, but just so that they are making sure that they're not in these events where you have a mass gathering of people and that this virus might spread quickly.
That I don't know exactly what an absolute quarantine means.
Yeah.
But when we look, at least historically, not always, but sometimes, and mostly people point to the 1918 flu, that you compare instances in which there are large gatherings, parades, and instances where those were where they were not allowed. You find a difference in terms of the transmission of disease. For that, that's the justification for avoiding those large gatherings.
I had a quick question for you. When we watched this a couple of, I would say weeks, but it was days, just a couple of days ago, when this was really blowing up in Wuhan, China, this was something obviously that it's awful to see, but you're not in direct relation to it. It's very far away from you, so you had no idea that this would even have any effect on you. And within a matter of days, we've seen restaurants starting to suffer. We're seeing conventions that are canceled. A lot of business that's being hit hard right here in the city because we are a tourism industry. So all of the tourists and all of the people that would initially come here probably staying away. I mean, honestly, how did it get to this point? And I think that's the question that we all have. How did we get here?
A number of lessons we have learned. First is, even if it's happening far away from us, it's happening very close to us, meaning that the world needs to be prepared. And so distance no longer exists. We can take a flight and in 8 hours we are wherever we want to be. And so preparing early, preparedness may not be the sexiest thing to do, but it is the smart thing to do, whether it's for the flu or a disaster, a flooding, or in this case, a fire. So early preparedness is key. Working together to do that is very important. Having a consistent leadership and consistent resources, both funding and people resources, are critical to address those issues. And making decisions based on facts. There's a lot of fear there that doesn't have to be there.
Casting back all the way to the beginning of January, I don't know if we remember January, we were asking ourselves the question of how transmissible this virus was. There are lots of other conditions out there that have affected just a small number of people and not spread outside of their region. And I think people were watching this and we didn't have that information. That was the big question. How transmissible is this? Is it only from animals to humans and then stops there? There are some diseases like that. West Nile, for instance, is not a disease that humans continue the transmission cycle. It's in animals to humans via mosquitoes from birds. So everyone was wondering what was the nature of this disease, and it was actually when it was relatively late in a way, when there were hundreds of cases, people recognized that this disease can be easily transmitted to humans. And even then, the question was easily. Now we know easily transmitted to humans. And that makes all the difference in terms of its ability to be transmitted around the world. And we didn't know that initially. We can only use analogies to guess. We didn't know it was a coronavirus. So we can compare it to other coronaviruses. Some, like MERS, have not really left the Middle East. Some, like SARS, like this one, seems to be able to go around the world.
So this is something that's directly or closely connected to SARS?
It is in the same family.
It's in the same family. Yeah.
Okay.
So when we talk about the pandemic, there are three conditions, so to speak, three criteria. One, it's a new virus. We haven't seen this virus before, which is correct, so yes. Second, it infects humans and it causes serious disease. We've seen serious disease, we've unfortunately seen deaths. Thirdly, it spreads easily from person to person, and it is sustained. That transmission is sustained. So we now have satisfied all three criteria to call it a pandemic.
Well, what about this? Obviously you have some people who are getting this virus, they quarantine, they go through the proper treatment, and they are, I wouldn't necessarily say cured. There's no vaccine, am I correct?
Correct.
Okay, so is this something that you can catch again? Is this something that along the line we're one and done, or what do you think?
This is a question that public health professionals have been asked before. Remember, I mentioned that this viruses can be tricky and they can change. So if they change, and a scientific word for that is mutate, if they mutate to become a different virus, the nephew of this coronavirus, you might be infected again.
Oh, okay. So it is a possibility.
But not for this one.
Not for this one.
Correct. And in addition to vaccines, there are a number of manufacturers that are working on treatment as well. And so we should be sensible, we should do the right things in terms of protection and control, but there's also a lot of work going on in the vaccine area and the drug development area.
There were a lot of people who are postponing, obviously, the NBA season. A lot of things are being postponed towards the fall season of the year. They believe that by that time, this should or could blow over. Is that a hope that you both have, or do we feel like we'll see this continue to spread?
It's certainly a hope that I have, but I have no idea whether that will happen. I look at the example of China, and if it is because of what they did, we may be in trouble because we can't do that. But if it's because of the biology of the virus, this really started to show up at the end of January. It peaked in the middle of February, and they're now down to like 40 cases over the entire country over a 3-month period is what the big arc of this thing has been in China. That would be great if that happens here, but I couldn't guarantee that that's what we're going to see. Like Dr. Lichfield said, one of the things that we don't have on a new virus is that there's so much information we don't know.
I hope that it peaks before the fall flu season.
Because we could see this get worse.
Again, together with the flu season.
Ugh. So you're hoping that this goes down. But, you know, like I said, you know, you've spent time with the CDC. They're coming up with a vaccine as we speak, hopefully.
It will take some time.
Yes, it'll take some time.
Actually, the National Institutes of Health are working on a vaccine.
Okay.
Dr. Fauci and his team.
So they're working on a vaccine right
Yeah.
now. If that does happen, how does that get distributed? You know, what's the next step? Once we find a way to kind of conquer this, how do we move forward with that?
Well, if there is a development, if there is a vaccine available, the vaccine has to be produced so that thousands and millions of people can be immunized, right? Can be vaccinated. So that will take some time too. And then it will follow the same distribution strategy as you have. You could go to your CVS or Walgreens or your primary doctor office and get vaccinated, but that's still some ways away.
All right, well, Dr. Maureen Lichfield joining me right now, and Dr. Ronald Blanton, if I can get that one out. If you're just joining us right now, we are keeping you covered with the latest on COVID-19, obviously answering a lot of your questions. You can continue to send those questions in 504-529-4444. And some of you have some very interesting questions, of course, regarding schools, regarding pregnant women. I know that some people were very concerned about transmission, how this works. Just to give you what I've gathered from this, we wash your hands, stop smoking if you're smoking. It's a good time to make sure that you are getting enough sleep at night, making sure you're eating healthy. I don't know if you mentioned taking a multivitamin. Just keep yourself healthy, right?
Keep yourself healthy.
I mean, and that should probably kind of lessen some of the symptoms here. And I know that a lot of people ask questions about the comparison between the flu and the coronavirus. There is no comparison between the two.
They both can cause severe pneumonia, and it seems that this virus, perhaps a little more easily even than the seasonal flu, can cause pneumonia. But again, it's a little more easily. It's not that everyone who gets infected will end up with that disease. But some of the comparisons are similar in terms of the nature of the disease.
What's a bit tricky is that the initial symptoms very much look like flu symptoms.
Yes.
Coughing and sneezing and a cold. And so when that happens, when you have that, we want to make sure that we know what it is.
Yeah.
But it is not the time to, again, it's not the time to run and go to the emergency room or the doctor. It's the time to call.
Yeah, I was saying that this virus is sort of creating sort of a stigma even. You're seeing a lot of people who are now becoming fearful of anyone who sneezes or coughs, and this is not just people like me who have anxiety, but people who are. I sneezed in the grocery store recently, and the looks on people's faces were hysterical because everyone was so fearful of this could be a symptom, but to my understanding, I don't believe that sneezing or sinus issues is part of this.
Especially this time of year.
Yeah, is that what you sees it? I have to explain myself all the time.
And you could have both, it's true, but one is more common than the other.
Yeah.
And sneezing is not a big component of just the COVID. At least it does not appear to be. There are always exceptions in medicine, but in general, it's been cough and high fever are the real hallmarks of this disease.
Thank you for bringing up stigma. This is not the time to create even more stress.
Yeah.
This is the time to come together, work together. Maybe not physically come together, but work together.
Come together, but at 6 feet.
Yes. To do the right thing, to protect, to take precautions, to prepare.
All right. Of course, we're going to continue our coverage with this on our website, WWL-TV.com. Continue to send those questions in. We'll give you the very latest headlines at 504-529-4444. Dr. Maureen Lichfield and Dr. Ronald Blanton, thank you for joining me.
You're welcome.
Thank you.
Of course, we will continue our coverage of COVID-19 on WWL-TV Eyewitness News at 5 o'clock. That'll be on your television screens in just a couple of minutes.